Okay, Visit Verified. We're going to review over Visit Verify, which is obtaining a patient's signature during your visit to the patient's home through the Kinzer software. First, we're going to go over just a review of what Visit Verify is and some different things about the product of Kinzer. Visit Verify is obtaining the patient's signature. It captures your location and also the signature location. So at the time that you pull up the signature, in order for the patient to sign, it will show on the GPS on your tablet exactly where the particular location is at the time of the signature pulled up. Also, it will pull up the information on the patient's location or the address information that we have in the system, and we'll go over that shortly. In order to use Visit Verify, you do have to use either an iPad or a Samsung Galaxy. If you don't have either an iPad or a Samsung Galaxy, you will need to make sure that you sign in the patient's log and then have the patient to initial, and we'll go over that shortly also. When you're having the patient to sign on your tablet, make sure that you are using a stylus. We're doing that in order to, as a just a basic standard universal precaution from different patients touching on your tablet, because then you would be able to wipe your stylus with an alcohol wipe between your patient visits. We actually started the Visit Verify on January the 15th of this year, 2015, and all visits with signatures will show on the patient's chart, and as we go through you will see an example of that. If you don't have an iPad or a Samsung Galaxy tablet, you must make sure to sign the log in the patient's home folder and then have the patient to initial beside your name. Now we'll go over the Visit Verify instructions. As we go through, you'll see screenshots of the particular instructions that I'm going over during that time. First, whenever you log on and in your hotbox, you will see a red house, or you will see a green house with a check mark. The red house just shows that the Visit Verify has not been done yet. Once you see the green house with the check mark in the middle of it, that shows that the patient signature has been obtained, and you'll see that later on in the presentation. So when you get started in your hotbox while you're at the patient's home, you want to go ahead and click on the red house, and you'll see that in the screenshot below. Next, when you click on that, the patient's information will pull up, and you want to make sure that you verify that patient's information. So you have the patient's name, the date of birth, their start of care date, their medical record number, and the patient's address. If that information is correct, then you will go ahead and click on the Get Patient Signature at the right-hand corner, as you see below in the screenshot. Once you click on that, notice a privacy will come up, and that's just allowing the patient to see and know that we will be keeping their information confidential and according to HIPAA guidelines. You'll see that in the screenshot below. Make sure that you're using your stylus in order for the patient to sign. You have them sign inside of the rectangle box, and then click down at the bottom on Save in order to continue. If for some reason the patient needed to re-sign, you can go ahead and click Clear, and they can re-sign. Or if you want to not do the signature at all, you can go ahead and cancel it altogether. If for any reason the patient is not able to sign, then there's a little box right below the rectangle that says that the patient is unable to sign. You could click on that and then click Save. Once the patient signs and you click on Save, it's going to show the patient the thank you screen, which will just basically say thank you for allowing Home Care Network East to care for you. And then you would click on Continue, and then this will take you back to your hotbox. Once you're back in your hotbox, you will be able to see the greenhouse with the check in the center of it, which shows that the patient signature has been obtained and saved, um, as you see in the screenshot below. Once you have done a visit verify, it will from then on show on that patient's chart. So anytime that you click on inside of a patient's chart, you can always visualize the visits that actually had a patient signature obtained, as you see in the screenshot below. If you click on that greenhouse, you'll see the screen below. It recorded the location. It has the patient's address and the signature location. You want to make sure that those match. If for any reason that those are not matching, make sure that you contact the office so that we will be able to contact Kinzer. What we have been finding is, and it actually tells you on the screen that the accuracy is plus or minus 210 feet. So sometimes the address may be a little bit different, but it should be within the range of the 210 feet. But if it's way off, just let us know so we can make sure that we are contacting Kinzer and find out of a problem that we're having with the Visit Verify GPS. And you'll see that in the screenshot below. Just a real quick review of Visit Verify and what we've gone over. Whenever you log on, you want to make sure in your hotbox that you tap on the red house icon. Once you have that open, you want to tap on the Get Patient Signature. Allow the patient to sign. Make sure that you're using your stylus, or you can choose that the patient is unable to sign. The patient or yourself should tap Save, then tap Continue, and then it will show them the thank you screen, and then you can proceed onto your clinical document because it's going to take you right back to your hotbox for you to be able to start on your notes. Keep in mind, if you have any questions, you are always able to contact Latanya Williams, who's your corporate educator and trainer, at lwilliams@homecarenetwork.com. If you have any other questions about Visit Verify or any other clinical type questions, you can also contact her, or make sure to contact your office and speak with your clinical director. Thank you for attending.